Welcome. This is Healthy Communities, a series where we talk about how we build safer communities, more inclusive communities for everyone through violence prevention. I'm Charity Jordan Rex, the Prevention Education Coordinator with Harmony House, Missouri's largest domestic violence shelter. And this is a project of Harmony House. Joining me today is Dani Lassio, equality organizer with Promo, a nonprofit organization focused on LGBTQ equality. Dani is a fierce advocate with a focus on education, has been a part of the Springfield community for over 20 years. They serve on so many different boards and organizations. Springfield Public Schools Community Collaborative. They're a member of the City of Springfield Sexual Assault Task Force, a member of the Springfield chapter of the NAACP, PFLAG of Springfield, Planned Parenthood, Missouri Jobs with Justice. And one of my favorite details about Dani is that one of their mottos is we have to become comfortable having uncomfortable conversations. The more uncomfortable the conversation, the more important it is to have it. Dani Lassio, thank you so much for joining me.
Thank you so much for having me.
Tell us a little bit about Promo. You work for Promo, and for folks who may not know what that is, what's Promo?
Sure. So Promo, Missouri is sometimes how we get referred to. And we are a statewide LGBTQ plus public policy and advocacy. So what that means is we spend most of our year in Jeff City fighting the legislation. And occasionally we get, things like Mona where we get to go through and actually be for things. But aside from just that and say, why, yes, we are a statewide organization. We are located in St. Louis, but I'm actually here in Springfield. So we are expanding our outreach and we also have a contract person in Kansas City. So trying to get all the, major cities here in Springfield to go through and represent and just uplift the LGBTQ community so that all of them are thriving. And some of the ways that we do that is by also offering things like education cohorts that LGBTQ adults and youth can go through, as well as also just working with other organizations within those cities to uplift them and, try to make sure all lives, regardless if they're LGBTQ or not, but marginalized people that are oppressed, to just give them the resources and the support that they need so all of us can thrive.
I love that. And that's really at the core of what Harmony House is about. I mean, our work is centered around domestic violence, but I wanted to bring you on to talk about that LGBTQ perspective because we know that domestic violence impacts literally every single demographic, but within the LGBTQ plus community, they may face additional barriers. They may face additional forms of abuse because of their identity or their orientation. And I wonder if you can explain a little bit for folks who may not know what that means. Like, what are some of those other barriers just barriers in general that LGBTQ people face here in our community and in Missouri?
Thank you very much for that question, because that is such a thing that we need to educate and have more awareness around. So I am a trans individual. My pronouns are they, he, and there are the barriers of just being able to get healthcare, being able to go through insecure jobs, and that constant fear of when they find out who I am I going to lose my job? Am I going to get denied that healthcare and everything? So those are additional barriers, but what goes through and adds on to that is we go through and we hear, especially with the legislation that's going on, and say that particularly is impacting our youth. And say here in Springfield, in fact, this week, today, tomorrow, and Thursday, Greene County and our courts are hearing the SB 49, the gender affirming ban. And why, yes, that was signed, it's to go into effect on Monday, the 28th, and say ACLU and Lambda Legal are actually suing the state for it. And that's putting a halt on it from going into effect. And the reason why we're fighting so much on this is healthcare that we are denying. This is a barrier of just going through and having, those basic needs of I've got a cold, I need to go through and see a doctor, or I need to go through and a child is starting to go through puberty, and that gender dysphoria is creating so much mental dismay for them that puberty blockers may go through and help that. But we're creating legislation saying, no, you can't have that. That it doesn't matter what doctors are saying. It doesn't matter what other individuals, trans individuals are saying. We have cisgender legislation that's going through and saying, no, we know better than you. And what that does is that really impacts the mental health of people. So our youth particularly, so one of the group that Promo works with is called the Trevor Project. And the Trevor Project did a research last year, did a survey, and they found that like 76% of the youth are being negatively impacted by the legislation that is going on. And there are more instances of these kids either thinking about suicide, attempting suicide, or they're self-harming. And it's not because our gender identity creates like this defect in our brains to where we're going to think this way. No, it's because what society is doing. Society is going through and saying it's wrong to be this way. It's wrong to talk about this way. So when you especially do that for children, and and though they're taking adults and trying to model off what they go through and see, and if they're getting the impression from adults that this is wrong, they're going to feel shame. That goes through and creates, the gender dysphoria. That goes through and creates the mental struggles that we, whether we are adults or whether we are youth, are having just because of our gender identity, because others aren't comfortable with who we are. And I see that not just at, like I said, the adult level, and say this SB 49 bill, yes, is targeted at our youth, but additionally, it's going through and saying adults that are on Medicaid cannot get gender affirming care anymore. Those that are incarcerated cannot get gender affirming care, and say that's a huge barrier to go through and say, adults, you can't have health care. So why healthcare is a big barrier in Springfield and in Missouri, one thing that I kind of run into additional barriers, not just finding that healthcare, but jobs. And say I have a friend right now who he spoke up about, an individual, a public official that had gone through and said some very derogatory things about the LGBTQ community. And now my friend is at risk of losing his job over that. There's other instances where I get lots of floods of questions of people saying, hey, I am a queer individual. Where in Springfield can I live that's going to be safe? Because we do have individuals that have been physically harmed. Springfield themselves even had a transgender individual that was murdered here just by being downtown minding their own business. So, I mean, it's not just health, it's not just safety, it's jobs. I mean, there's so many different barriers that we are creating. And then you have the Springfield Public Schools, and they're trying to go through and remove like safe space stickers and pride flags, even to the point that we worry that at this path that they're going down, that we may potentially go through and determine what children can wear, to where we're saying a Black Lives Matter shirt is too political. And I'm like, that's not the issue here. And say, nobody is trying to go through and say that the LGBTQ community, the Black community, the Asian community, nobody's trying to go through and say that these communities are better than others. We're just trying to go through and say, hey, these are some issues that we're running into that we see that this group, these cisgender white Christian individuals, aren't going through and having. So help us. That's all we're going through and doing, is saying, help us go through and be able to be at that same starting point that they are. And there's just so much pushback about it. And for me, I feel from my experience of being a queer individual here in Springfield for the last 20 years, it's just fear. It's fear of what we don't know. So that's why I'm very thankful that we have opportunities like this. And I am very thankful that people, engage and, watch these, is because that's how we make those changes, by having these conversations.
Exactly. I think that's you just said it. That's how we make change. And there are so many great points that you just made. And I think it's worth pointing out that for folks who are watching this who may not be aware, 1 in 3 women, 1 in 4 men are experiencing some form of intimate partner violence, domestic violence. And we know that those rates are underreported. And if you're a part of a marginalized community, a person of color, someone who has a disability, or someone who's part of the LGBTQ community, those rates are even higher. I wonder, I want to back up though just a little bit, and you were talking about barriers to healthcare, and I wonder if you could explain that a little more, because I know everyone out there has had an issue trying to find a new doctor, going to the doctor, not like, we've all had issues with that. So I think that's something that is a universal experience, and we all
Mhm.
understand that. But what specifically happens to create an extra barrier for LGBTQ folks? Can you drill down on that a little bit more?
Sure, because you're right. Yes, our healthcare in Missouri, Springfield, United States is not that great. It does take a little bit to get in. I mean, I personally switched my primary caregiver, and it has been 3 months, and my first appointment with her isn't until September 14th. So I'm still waiting just to get in. And it has nothing to do with gender identity or sexual orientation. It just has to do with the fact that that workforce is kind of, depleted at the moment. But one thing that so what happens, say for instance, and say this is called the broken arm syndrome. So let's say I'm walking down the street and I trip and fall and break my arm. I go to the emergency room, they go through and they x-ray, do all of that stuff. And then it gets sent to the insurance, and the insurance goes through and says that I'm a trans individual. And then they deny all of it, saying, well, all of this is because you're trans. And I'm like, no, I broke my arm, had nothing to do with the fact that I was trans. But they end up going through and trying to lump everything together to say all of it is being trans, all of it, is from that. And then they deny those services. And why that's an extreme situation, something that people deal with mostly every day that I hear from quite a bit of individuals is that when they try to go through their primary caregiver to get on gender affirming care, or what we also called as gender hormone replacement therapy, what happens in that situation is the doctor will go through and deny them, saying, well, we can't go through and do that. And then you'll have to go to a different person. And then that doctor may not know how to work with the hormone replacement. Or say you do go to the doctor and you just have a cold, but because you are on hormone replacement therapy or gender affirming hormone therapy, you go through and you can't get your cold medicine. You can't get it on an antibiotic because the doctor is going through and saying, oh, well, all of that is related to your gender affirming care. And so we can't go through and treat you at all. So, I mean, that is a barrier to where it's not about your gender and saying it's just about basic healthcare, being able to get on an antidepressant, being able to get on cold medicine, being able to have those yearly physicals that all of us really need. And when we don't have healthcare that we can keep up with and maintain, that does go through an impact long term as well. So I feel like I have more individuals in my community that will go through and say, I'm just not comfortable putting myself in that situation. I will use myself for example. So I had stage 3 breast cancer. So when I initially went in to go through and, see about having top surgery, say that's when we found out that I had the cancer. And everything then changed from just the she pronoun being used constantly, and putting me in the women's ward, putting on the maternity ward, and just it no longer became about me as a person, but trying to go through and make sure that how did I want to look as a female, and not the fact that I was coming saying my pronouns are they, he, and saying that I do not go through and identify with the she. But I mean, that was a very uncomfortable situation. And now that I am over 10 years out from my remission and I can restart my transition process of having the surgery and having going on testosterone and everything, now I'm running into barriers of, is that cancer therapy or is that gender affirming therapy? And neither of the doctors wanting to go through and work together, or having doctors go through and say, well, you had this surgery because of cancer, so we can't do this surgery. And I'm like, that doesn't give me what it is. And it's just a lack of education. Thankfully, I'm the individual that just is persistent and kept inviting somebody. So they're like, oh, yeah, we can do that. That's not a problem. But not everybody has that privilege to fight like I have. That's why it's so necessary that we have our hospitals like Cox and Mercy make statements of being accepting places, have resources that are more tailored and that it is more welcoming so that ongoing health care can be provided for all individuals.
Oh, I just can't even imagine. I mean, navigating the healthcare system in this country is challenging enough as it is, but when you have those additional barriers just to getting the most basic care, um, there are no words for that. And one of the other things I will point out is that uh, I hear some people say that, certain groups, oh, they want special treatment, but it's not about special treatment. It's really about equality. And if we can make our community a better place for the most marginalized people in that community,
Mhm,
everyone in that community is going to do better. And what we do know is that the more inclusive a community is, where everyone feels welcome, everyone feels safe to be who they are, those are safer communities. And so
mhm.
when we talk about reducing violence, doing our part to make everyone in our community feel included and feel welcome, that's going to lead to a safer community.
Mhm.
Danny, thank you so much for joining me. I really enjoyed this conversation so much.
Well, thank you so much for having me. I appreciate the opportunity to talk about our community because when we talk about things and we become comfortable with things, we're less likely to fear them because that's where most of this all comes from is we fear what we don't know. We fear what's not in our circle. So in order to make those safe places and make people feel, inclusive, we have to be intentional on educating our awareness on other lived experiences.
Exactly. I co-sign on all of that. Thank you, Danny, so much.